Hi, my name is Dr. Alan Maddock. I'm a lecturer in social work at Queen's University Belfast. I'm going to speak to you guys today about my PhD research, which was conducted in Trinity College Dublin, looking at the impact of mindfulness based cognitive therapy, which is mindfulness intervention on psoriasis. Mindfulness based cognitive therapy is an 8-week intervention. It's usually done in a group and it's 2 hours in duration. The original idea behind mindfulness based cognitive therapy was to support people with chronic depression. And it's been adapted for different populations. So what the idea is that there's a group facilitator. They'll walk people through different exercises over the 8-week period, and will also provide psychoeducation around about their thoughts, their people's emotions, a bit more information around how they operate together, and physical sensation and the bi-directional nature of them. So if something is impacting your physically, so if psoriasis, that might impact how you think. So you might think more negatively about what's going on around you. You might feel sadder as a result. So kind of how to explore those particular your physical emotions and your thoughts. And then it's around really kind of sitting down and learning how to meditate and going through that practice. So through body scanning gives you greater awareness of your body. It allows you to change your attention. So if you're thinking about something or worrying about something or ruminating about something, oftentimes if you focus on the body, what will happen is your attention will shift back to the present. And from that, usually what happens is the negative impact of ruminating and worry, which can cause stress and anxiety, will oftentimes just dissipate, and you'll be back and you feel more centered and much more relaxed, and your well-being should hopefully improve because of that. So it's a gradual process, so it's a fairly intense intervention in a sense, but it's really good. So people will then, as part of their homework, will be asked to meditate for 35-40 minutes, 6 out of 7 days, just to get that practice built up. And by the end of the 8 weeks, participants ideally will have actually quite a detailed experience of mindfulness itself. And within the interventions itself, talking to the facilitator, they'll walk through your individual experience to help you kind of learn about what you're experiencing yourself. So you'll have someone with you who will actually do the meditation, and then there's kind of like a question and answer session after each particular practice to help you really integrate that into your life. And then the last week in particular is around kind of integrating how you're going to work it into the rest of your life. And it's based on, there's aspects of this of cognitive behavior therapy in it too. So week 5 and week 6 or 4 and 5, they really walk through about like how we can spiral. So if we have negative thoughts, how we can spiral, and it can actually really impact our mood quite negatively, and how to avoid that, and how mindfulness can actually help you from stepping out of that kind of spiral. So the probably strongest components are things that people could do in everyday life that we found to improve their anxiety or their feelings of low mood or improve their psychological well-being, was being kinder to themselves. So the idea of self-compassion. So if you do have a flare, realistically, what you'd hopefully do is not beat yourself up over that. It wouldn't be your fault. It happens to a lot of different people. So this is very common. So the idea would be that that's happened, but there is no negative self-talk, and you just kind of give yourself a bit of an emotional balm. And that can prove to be very effective. The other piece was interesting was obviously mindfulness itself. So your ability to stay in the present would likely be kind of really useful. So even without mindfulness practices, you can do that by doing yoga, go for a run, although yoga is probably mindfulness practice, but you can do other forms of yoga, go for a run, exercise, go to the gym. These are all things that can really help you to stay mindful without meditation, although obviously mindfulness meditation help you to be more stronger and rigid in that. Other things again was like, instead of avoiding things or putting things off or not dealing with things, is actually to approach them and kind of take them on and kind of try and experience them. Ideally with mindfulness meditation, what that does is gives you more of a kind of a solid feel in yourself, so that can be really helpful. But again, you can do that in everyday life through other interventions and ideas that you can use, like so CBT is another intervention that can be used in that context to help you to approach the sources of your difficulty, because the longer you put them off, they can cause more stress, more anxiety, and your mood can be lower because of that. And the other piece as well was really around kind of focusing your attention. So if you are worrying and if you are ruminating about something, or there's something in the future that you're concerned about, something that's stressing you out tomorrow, a meeting at work or anything along those lines, or if it's something in your past you're thinking about that you're constantly thinking about, it's really important to be able to try and shift your attention back to the present as quickly as possible. So just focus on your work as best you can, because the more you worry, the more you ruminate, what happens is you tend to be more stressed, more anxious, and the mood tends to lower, and obviously well-being is impacted as well. So if you're able to bring your attention back to the present, that's really useful. And ultimately what happens with worry anyway is that 99.99% of the time it doesn't happen what you're worried about, that kind of way. And if you're ruminating about something that happened before negatively, oftentimes you're probably blaming yourself for something that wasn't your fault. So that's again where it's really important to have self-compassion for yourself in those contexts. And if you do, it seems to be that your anxiety and depression based on our findings could be changed. So by comparison to evidence-based for the likes of cognitive behavioral therapy, mindfulness is still in its infancy really. So cognitive behavioral therapy has been around for a long time, so there's been more evaluation. So I think if you're going to say what's the go-to intervention for people with anxiety, depression, particularly I would say CBT would still be something I would recommend, and based on the research evidence. However, this study does provide decent evidence for mindfulness-based cognitive therapy to support the needs of people with psoriasis from a mental health perspective if they have those issues and improve in psychological well-being. So I think this study needs to be replicated, needs to be more research around it, because as I say, there's a couple of other studies around psoriasis and the findings were more mixed. Now this study, I think it's fair to say, has got the strongest power, as they say in research terms, so this is probably the best study out there in this context, but it does need replication. So from a clinical perspective, I suppose, I think psychologists and dermatologists, I think it's fair to say that they should be speaking to psoriasis, people with psoriasis that come to them that might have issues with anxiety, depression and psychological well-being, and talk about maybe what role it could play in their mental health treatment if they were looking for it. So it could be what they call a step care approach, in which someone might do a mindfulness-based intervention and then work towards going into CBT, or if somebody is doing CBT, they may step out of CBT into a kind of a longer term skills-based piece, which mindfulness can be. So they could do the 6 sessions or however long, 12 sessions of CBT, and then maybe they might enroll in a mindfulness-based cognitive therapy group in order to, strengthen the work that they've done before, and kind of embed that and learn new skills and how to approach and deal with their anxiety and depression. So it's a very flexible approach, mindfulness. So I think in time what will happen is interventions will be adjusted and changed. Our research actually provides the basis for which a researcher come along and actually do a bespoke mindfulness intervention for our psoriasis patients based on some of our findings.